Amyloidosis. Okay, what is amyloid and what is amyloidosis?
Amyloidosis is a formation of amyloid. Amyloid are the abnormal fibrillar, abnormal proteins that are folded abnormally, and they are called the fibrillar protein polymers.
Okay. Normally, the amyloid, okay, amyloid are normally, this is abnormal folded proteins. Abnormal folded proteins, okay? If these abnormal folded proteins are much more in number and it cannot wash away from our body and it accumulates in our ECF, then there will be a disease process. This is known as the amyloidosis as a whole, okay? But you have to know about the amyloid. Amyloid is simply a misfolded proteins, okay? You have to have the clear idea about that in the first place, okay? So from where you can have this amyloid?
They are actually found in the extracellular space.
Yes,
extracellular environment.
Simply, there are, I can say, like thousands of proteins that are like forming, okay, in like every time inside of our body, right? But these proteins are engulfed by or destroyed by a certain enzyme. This is known as proteases, okay? These are known as the proteases. But when you have like enhanced amount of these abnormal misfolded proteins, and if there is a lack of proteases, that it cannot degrade or it cannot engulf that abnormal amyloid, then you can have this amyloidosis inside of our body. Okay, then it will be a problem. Normally, the amyloid, suppose the size of the protein should be just like this, okay? Maybe it should be the protein that has been made from our cells, it should be like simply a straight. But in case of amyloid, maybe this is not a straight, rather than this is something like this, okay? So this is misfolded protein. And when this misfolded protein will be much more, that means it can lead to like form like this or this, okay? They will accumulate together and you cannot eradicate this from our body, and that's a problem, okay? That's a problem. And ultimately it can form what is called a beta sheets, okay? This is known as beta sheet because of the excessive amount of amyloid deposition. These are known beta sheets, okay? So when these beta sheets are like deposited into our extracellular spaces, it can cause some damage itself, okay? And that's a problem. It can cause damage. These beta sheets are very like, it's not good for our body. So these beta sheets can do two things, okay? It can do, one is systemic deposition, systemic deposition, and it can cause some locals, okay? Systemic depositions, that means you can have some multi-organ failure because of the systemic depositions, and that's when you can differentiate between the primary amyloid, primary and secondary, okay? Okay, let's break it down. When you can have these primary amyloidosis, Dr. Akinbullah, why this is named as primary amyloidosis? Do you know? Okay, the Primary amyloidosis. Okay, the primary amyloidosis. This is mainly known as AL, amyloidosis. Okay. This is known as AL amyloidosis. A means amyloidosis, okay, and L, it means it will have light chain. Okay, light chain. Okay, why light chain? Because from the plasma cells, like from the bone marrow itself, okay, if there is a production of these proteins, and if there is a problem in the plasma cell disorders, something, okay, it can cause some misfolded proteins, and it will have a lot more amount of this light chain. Okay, so if there is a huge amount of light chains and these are misfolded, then it will be known as AL amyloidosis, and these are known as the primary amyloidosis previously, but now we tell the AL and the AA type, right? So
yes.
if this AL type is much more, okay, and it can build up into the tissue, and that can cause some damage as well. Okay, next you have to think about the secondary, or this is secondary, previously called the secondary, but this is now what we call it A and A amyloidosis. Amyloidosis. Okay, what does it mean by AA?
Amyloid associated.
Okay, can you tell me more, Sanjeev?
It may be secondary to other chronic conditions like rheumatoid
Excellent.
arthritis or chronic renal
Excellent.
failure.
Why? Why? The question is why.
Maybe.
Okay. Go ahead. Yes. Maybe.
I don't know. Maybe some other pathology triggering the misfolding of these proteins.
Okay. Simply think. Okay. We have our liver, right? From the liver, there is a formation of serum amyloid A, and this serum amyloid A is a acute phase reactants, right? And it will release in each of the inflammatory process. Okay, so think about some of the chronic inflammatory process when you can have these acute phase reactants in a large amount, and it is producing in a regular basis. Okay, so what are the chronic conditions we have? We have the rheumatoid arthritis, we have inflammatory bowel disease. Okay, we have some cancers. Okay, we can have some cancers as well. We can have this is a very rare thing, the familial Mediterranean fever syndrome. Okay, these are all the chronic cases. In chronic cases from the liver, the acute phase reactants will be much more, and you will have this serum amyloid A in much more amount in the bloodstream, and from those you can have some of them can be misfolded. Okay, and because of those misfolded proteins, if it accumulates, as I said, if it accumulates in a larger amount and it cannot be degraded by the proteases enzyme, then